All right, here we go. Very welcome, Dr. Rob Meeder, today to Family Mental Health's interview. And
Yeah,
I'm
thank you.
quite a bit excited to match Canada and Switzerland. And
Mhm.
I'm really thankful to learn
Mhm.
about your work and how it is going in your country with mental
Yeah,
health for families. Would you like to introduce yourself a bit?
I will for sure. And thank you for inviting me, Danielle. It's my pleasure to talk to you today. And I think it points out too that this is an issue that's around the world. It's not just in Canada or in the United States or in Switzerland and Europe, but it's in Africa, it's in Australia, it's in Europe and North America. I mean, it's everywhere. Stress and trauma and how we respond to it. I mean, our human brain is really the same no matter where you are. So I'm glad that we can cross borders and meet like this and talk about what I do with mental health and behavior in my practice. So I am in Canada, in Ontario is a province. I just sort of north of Toronto is where my clinic is based. So the Great Lakes area. It's wintertime here. It's freezing cold, snow. We have a lot of snow on the ground right now, and trying to enjoy that. So I have a practice that's just in mental health and behavior. I'm a pediatrician and have been in practice now for getting close to 20 years
Wow.
of pediatric practice. It was always a very general practice, but in about 6 years ago, I switched over to more behavior and mental health only because the need was so great. It's funny how in the medical world, we still separate artificially mental health and physical health. And oftentimes physical health gets very much prioritized and mental health becomes sort of the second rate, or second in line to physical health. And of course, you and I know how much those two things are related. And in fact, they're almost inseparable. And it's also really not fair to think that, okay, physical health is much more important than mental health, because it's fine to be alive, but it's much as important, if not more important, than to feel alive. And so, I think we need to get that message out there. And I work with kids and with their families. I am now the medical director here at Waypoint Center for Mental Health Care in the program, a new program called Family, Child, and Youth Mental Health.
Wow.
So I every day I meet with families, with kids and their parents and the caregivers to discuss any mental health concerns that they have.
Yes, wow. I was so impressed. I recommend it later to everybody. The podcast you run. I have some
Yeah.
things in the ear like pills don't teach skills and behavior is only the iceberg. So important quotes.
Yeah.
How did you get there? Could you tell us? Because I think we need this paradigm shift you're talking about. Everybody knows it, and there's still some taboo or whatever.
Yeah.
How did you get?
Well, so thanks. That is a great question and so important too, because I agree that for me, there was a huge paradigm shift. When I went through medical school, which was in the late 90s, the ACE study was out. So Adverse Childhood Experiences study was out, but I never heard about it. I was not taught about it. In fact, I didn't hear about it till like 20 years later, which just goes to show you that, there was the medical model of seeing disease and then providing treatment it works well for some physical ailments and diseases and disorders that are out there, but doesn't really work that well for mental health. And categorizing and classifying things, the DSM-5 manual, which is often still used to diagnose, I think has some really significant limitations, especially when it comes to kids who are developing. Families sometimes think that the ultimate goal is just to get a diagnosis and then that's it. Whereas, things are very fluid, things are very environmentally dependent. It's not like the child just has a diagnosis. Usually there's a whole family unit and a community involved, and all the environmental factors that probably play as much or more of a role in the behavior that we see in the child. For me, a really turning point is the concept of developmental trauma, which I just kind of happened upon when I sat in a lecture from the Adoption Council of Ontario. And as you know, a lot of adopted kids have had trauma in their past. And so they were really promoting this concept of understanding their behavior through the lens of what happened to them in early childhood, right? And we can get into that in a second. But at the same time, I was reading Ross Green's book, The Explosive Child, and understanding behavior, not just as like kids just trying to be difficult and, trying to upset their parents and being mean, but really like what you just quoted, that, kids will do well if they can.
Yes.
And so I think that just changes lenses. Ross Green talks about how we need to just change lenses and change how we view things. And at the same time, I was reading Bruce Perry's work, The Boy Who Was Raised as a Dog and Born for Love. And again, this whole concept of developmental trauma in his latest book, What Happened to You with Oprah Winfrey, is really like not so much what's wrong with you, which is very much a medical model approach, but what happened to you. And if you start seeing kids with behavior problems, you understand very quickly that there's often a backstory, and a backstory sometimes goes back generations. And we see this, cycle, this transgenerational cycle. We learn more about epigenetics, and then we understand, okay, this child's behavior didn't just come out of nowhere. A lot has happened to this child even before they were born sometimes, and then especially in the early years. And Bruce Perry's work is very valuable in pointing out how important the early years are. In fact, the first few months of life, how important those are from a bonding and attachment point of view. So that led to me doing more training in the neurosequential model therapeutics, becoming familiar with polyvagal theory, whole brain child, Mona Delahook's work. I mean, I could throw out a lot of names here, but the whole concept of how stress impacts kids, and that results in behaviors as kids try to manage that stress. Sometimes it's adaptive, sometimes it's maladaptive, and then that leads to people seeking a diagnosis and treatment, and sometimes us not really paying enough attention to what the stressors actually are, focusing too much on the diagnosis and not enough on what are the actual difficulties here and how can we address the difficulties, rather than saying this is such and such a disorder. What are the actual difficulties? How can we help this family move forward in a way that promotes growth and promotes development?
Great. I love this. I'm really trying hard to spread this, what we were talking about, these books, these people doing this work. And my question for you is, how did you get this into practice? I love this combination of the medical background and these new approaches, because that makes so much sense. How are you doing this in everyday work?
Yeah. So I think from my perspective, so I'm a medical doctor. I mean, that is still my training and my title. But I have, at the same time, I don't like the hierarchical connotations of like, there's a doctor and then there's everybody else. I think we really need to work as a team. And so I work very closely with a number of teams in my region that are usually social workers, therapists, psychotherapists, people who are just trained in providing more the kind of regular therapy that many families and kids need. And then I help to kind of, really what I find I'm doing more and more every day is more just education, just educating families about, this kind of concept of the changing lenses, understanding kids' behavior, how stress impacts their development, how stress impacts their behavior, and how we need to look at, all the factors that impact a child's behavior, rather than just, positive and negative reinforcement to modify behavior. And so I find during the course of a day, I'm talking a lot more. It's not to say I don't use medications. I mean, that is still a tool that, it can be a very useful function, but the focus has shifted from like diagnosis medication to more like, what are the actual problems from a holistic point of view, and who can help with that? A therapist, a dietitian, a social worker, a teacher. If we all look at it through the same lens and the same perspective, we're going to make much, much more impact in the long term on the physical and mental health of these children and their families.
Great.
So to answer your question, Daniel, is that we work as a team.
Yeah.
I don't work by myself, and I couldn't do this work by myself. And so a lot of it is educating families one at a time. I also talk a lot and I speak a lot on these topics. I have my podcast that, I'll get some guests on to speak on these types of topics as well. So
yeah,
that's how we do it.
Great people on your podcast. Wow.
Thanks.
Everybody. I looked at it before again. And how do you, with your team, integrate the families, the parents? I mean, could you tell an example, maybe for a child with panic attacks, or do you educate them how to co-regulate, or what are you doing?
Yeah, that's a great concept too. We talk a lot about attachment and anxious attachment and co-regulation, attunement. Yeah. I mean, these are all just such important concepts. And it's interesting because I think psychologists and therapists are starting to get this more and more, fortunately, right? So we're all talking the same language. We're all working through the same playbook. And that means parents are getting consistent messages. And then we point them to resources that, books that we know about, podcasts, online programs, positive parenting programs for sure, because, it's never like it's just the child who's the problem, let's solve the kid. It's the family unit. And so when I started my job here at Waypoint, I was very adamant that it was not that child and youth mental health, it's family, child and youth mental health. And so if we don't get the parents on board, if we don't educate them as well about these concepts, and when they hear it, it totally makes sense to them. Most of them they're relieved that I'm not just going to do a diagnosis and label them with something and give them medication. They're relieved to know that, okay, now I understand my child's behavior much better, and now I can see where I can intervene and help them grow and help myself. A lot of times parents see themselves, they see like, I could have used this, and then they see their own background when they were kids, and they see where their parenting comes from. And so, it's funny, I could spend hours with each family, I think, but I don't have the time. But I do love to talk about these concepts, and to a lot of families, it's good news in a sense that it empowers them.
Yes.
And,
so
they feel like they can do something.
Yeah. And are there programs in your area, really offline programs that they can meet in circles, parent circles, or something like this? Did you implement this, or? Yeah,
well, I'll give you one example. We have this one group here in my building, actually. So I'm connected with there's two organizations. One is called the Youth Wellness Hub, and it's for youth. It's run by youth. It's for youth. And so it's a safe place. If you talk about, polyvagal theory, how safety is just so important. You need to feel safe and secure in order to open up and to manage, to understand stress. That's a safe place for all youth. It's because it's run by youth. So that's a great place. The other interesting group that I just met with is the one called Mama Tribe, which is new moms with new babies. Wow. And I love talking about this kind of stuff early on. The earlier, the better, right? And so getting new parents, and I'm talking moms and dads here, to understand how to interact with your baby, how important that is, how important eye contact is, talking with them, understanding their even babies' behavior, when they're crying, are they, and not, how do you help them regulate? Like, they count on you 100% to regulate. And so these sorts of messages I wish I would have known this 15, 20 years ago, and I would have gone to the hospital and been at every delivery and said, here's a few things you need to know. Yeah. So this group is sort of a way to do that, is to really interact with moms who are at home with their babies. In Canada, we do have, options for maternity leave, and that's a perfect time to promote that healthy attachment, that secure attachment, that bonding. And so this group was great to talk to, with all these moms, and they were so great. And We
Wow.
talk about sleep and co-regulation. We could talk about, babies that are colicky and crying, and what does that really mean, and how they are communicating through their behavior, eye contact, language development. Like, if you can get it at that stage, you can cause
Yes.
such
Gold.
massive improvement, decades and for the rest of their lives.
Yes.
So might as well start early.
I love it. I saw you had Edgetronic on your podcast, and
Yes.
recently I showed a group of mothers I was working with the video, the still face experiment. I mean, it changed everything just to see this, and everybody said, "Wow, I would have known that before." Yeah,
Yeah, it's
right.
only well, I showed this mama tribe the exact same video. I
I
showed
know.
it that, and I said, look how important it is, that, and just even for them to hear that we don't need you to be the perfect parent. Nobody is going to be a perfect parent, but if you can, you know, attune to your child, and then, but when it's ruptured or when there's been a disconnection, you repair it. The repair is often more important than the rupture.
Right.
Your child can really grow from that, and that's Edtronic's message, right? Like, and Claudia Gold, I mean, their main concept is, it's mismatch and repair, mismatch and repair. But if you'd like, if there's a mismatch in your connection, in your attunement, in your co-regulation that doesn't get repaired, that's where the damage happens, right? That's where the maladaptive, poor defense mechanisms, the maladaptive coping strategies all develop when there's been no repair of mismatch.
Yes. And in the rupture repair process, you develop resilience. I mean, that's it. It's
Totally.
yeah.
Yeah, and it prepares you for the real world where there is going to be these mismatches, right? All the time. And to know that you have a parent and a family unit where mistakes are made, but then we repair it. Mistakes are made, and then we grow. That is healthy. That is good for your brain. That's healthy stress.
Yeah, great. Thank you.
Yeah.
Great. I have two more questions if we have time, but one is a bit special. What do you do? Because it also troubles me sometimes with parents who are really confronted with trauma out of their past, and they're not able to do it. And they're not able to self-regulate, not able to co-regulate, and you just recommend them to go to a therapist. Do you have capacities for that, or do you combine?
Yeah, I mean, to be honest, like, therapy here, I'm sure it's challenging everywhere, to find qualified and trained therapists who can.
Also in Canada, right?
Yeah, yes, yeah. I wish it was better. We're always working to make it better. We do have more, I would say, increasing understanding of the need for trained therapists and psychotherapy to deal with that, because you're right. Like, what I never used to do before but I do now, is I talk to parents about their own history.
Right.
When we take a history of a child, usually you start, the day they were born. You ask about pregnancy and delivery, but the day they were born and go up from there. But I think it's as important when you're talking about parenting and parenting challenges and behavioral challenges in kids, and how do the parents respond to those challenges, to find out, well, what was your history like? Like, how did your parents treat you, and what did they do when you were looking for their support, or what trauma did you have? Because if they've gone through significant trauma. I mean, I met with a child yesterday, and he was having some difficulties at school, and the question was whether he had ADHD. But his mother came from a background where there's a lot of corporal punishment. His stepfather, was a Marine, and very much like, tough love, rewards and punishment sort of idea of how you raise a child. And so this kid grew up in that sort of a traumatic, with a traumatic stepfather, with a mother who had gone through trauma herself. And then, there was a significant amount of domestic violence. The relationship ended, and the mother had to flee with the child. So this boy has experienced a lot of trauma, but it's in the background of, a generation of trauma before him. And that mom was great, because she was getting help for her traumatic past as well. The father was gone, he was not part of the picture anymore, but mom was really keen to use positive parenting with her child to break the cycle, to understand her own past and to understand why she's still triggered by certain things that can evoke a lot of emotion in her, and recognizing where that comes from and doing the work herself.
Wow, changing history of a family. It's awesome.
Yeah. But it's sometimes we would never have gotten that if we would have started at, oh, the child's having difficulty in school. It's kind of think like, well, what's wrong with the kid, as opposed to like what happened to him and what happened to his mom and his dad that set the stage for, this child not surprisingly have difficulties himself.
Great. And this is a huge message, this shift from what's wrong with the kid to what has happened to him, or even the parents, the grandparents. Thank you.
Yeah, and I would encourage all, pediatricians that are maybe listening to this, or family doctors, or whatever your specialist, like really go back a step further and say, like, what's the backstory here? Because, it also moves you to a point of more empathy too, to understand that a lot of these parents, they're not doing this on purpose. They want to be good parents. They want their child to grow up well. And, sometimes they just don't have the understanding or the skills and some just opening up that way of thinking, like, look, what is your past been like? What are some things that we need to address and deal with in order for you to be in a better space to help your child, to break this cycle of trauma that you've been through, and to help you just be the parent that your child needs in a healthy way.
Beautiful. Actually, I wanted to ask for the last question about the society situation, but what is now coming in my mind is also, shouldn't we train the doctors? Should we train the therapists more to face their own history, or is there something going on in Canada?
Oh, yeah. That's a good question, and I don't know the direct answer to that, but I think a lot of therapists go into this field because they've had personal experience with it, and then yes, it is extremely important that we address that, and we acknowledge that in ourselves, and that we take care of ourselves, because we can find ourselves in a lot of triggering situations if we're in child protection, for example, or if we're in counseling.
Right.
We need to be aware that we bring our own selves into those sessions too, and what we hear might be difficult and challenging, might make us react in ways that we hadn't anticipated. That's our brains work to protect us too.
Yes.
So it's really important for therapists to connect with. And so I'm part of we have a great journal club of therapists here in Montreal, Canada, that we meet with on a monthly basis, and we talk about trauma-related literature, but also support each other and say, like, look, this is a difficult field. We got to look after each other. We got to be respectful of each other and mindful that we are seeing a lot of difficult things that many people don't even know about, and we can't keep that bottled up inside. We need to look after ourselves too.
I love this. I've never heard about kind of this. I love this. We should do that here too. Very inspiring.
Well, you're welcome to join our journal club. I'll send you the link and the invite, and it might be a little bit late for you because of the time difference, but
that doesn't matter.
It's a great group, and we talk about some great articles and topics, and then also just have some great discussion afterwards. Which
I would love that. Thank you.
Yeah.
Okay. In general, thank you so much for having the opportunity to have a view into your work in Canada. And I want to close with, I will show this video as well in Zimbabwe. I'm building a mental health project in Zimbabwe, and I love what you've been saying at the beginning. It's just connecting the whole world.
Yes.
This work around stress and triggers and behavior and nuance. And thank you so much.
Thanks for having me. I know what we could probably talk about this for another hour.
Yes.
And it's hard to do it justice in just a half an hour, but I hope it maybe, tweaks some people to think about things a bit differently, or to maybe pursue some other areas of training like I have myself. There's lots of great courses out there that I know, lots of trauma courses, Bessel van der Kolk and Daniel Levine, and so many others in the field that offer some great training on this, and then you can use those concepts to talk to families. I think it really resonates with families in a way that stigmatizes a lot less and helps them to understand themselves and their children in a healthy way that promotes growth.
Good point for the end. I think we should encourage everybody to do the same. For me, it changed everything. I really,
me too.
Really thankful.
Me too. Yeah. Well,
good. Have a good winter. Thank you so much.
You too. Yes, you too. Enjoy.
Thank you. Bye bye, Rob.
Okay. Yep.